Richard, this is the film I promised you for self-treating the costovertebral or rib joints where they join the spine. And the piece of foam, you can lie on the floor and place it vertically. This is a very expensive model because it lets me move parts around. The way you get them to be accessible is that you cross your arm and your left arm over to the front of the right shoulder, and that'll bring your scapula out of the way, and then you place it inside the scapula. Now you can play with moving it left or right and looking for that sweet spot. The closer you get towards the midline, the more you're going to affect the thoracic spine. If you go a little bit lateral, a couple of inches lateral to midline, you're going to be on the ribs. Okay? Now you can also place it horizontally, and most people find it helpful in the region between the shoulder blades. Okay? As you get higher up, the curve doesn't let you get the first thoracic very well, but if you lean your head backwards, and if you had a massage table that you could let your head come off it slightly, that would make that more accessible. So just some thoughts. Okay? Now the first rib is a tricky little booger, but the way to find the area, the general area where it is you pinch someone's upper trapezius muscle in the thickest part, and that little knuckle that you'll feel is right below that, about one finger width below where you pinch. Now this anatomy is not exactly accurate because that tends to be more prominent, and this is covered with a lot of muscle, so really you do feel the knuckle of that first rib. So you can treat that by using a ball. I happen to use a softball to capture mine. And you can do that against a wall. You can even use that thing against a wall, such as if you're at an airport, whatever. So you need to find a ball that you feel works for you, and you can place it. I'm going to place it in the region of the left rib, and then you just kind of lean into it and kind of move around till you feel an area where that feels therapeutic. And then you can just lean back into that. And I really favor 2 minutes as a minimum. And you can do all of this once a week and maintain a lot of benefit. Of course, you can do it more often than that. Now, regarding the ankle exercises, you want to progress difficulty. And you want to capture my ankles now, Karen, and my whole body, actually, lower body at least. So you start off on that ankle, and you can challenge it by moving the other leg back and forth and then side to side. And you can use weights. You can swing them back and forth. You can lift them sideways, and you can twist the weights left and right. And that will really challenge all of those muscles and all those proprioceptive nerves to kick on and help enhance stability of that structure. I think 5 minutes a couple times a week would be great. When you're able to, you progress to standing on that leg on a trampoline, and then you repeat the drill. And of course it's very unstable, so you're just not going to be able to move your arms around much when you're on the trampoline. And whatever weight you could do on the floor, you want to cut down that weight. Okay? And what you can do is make the right leg a test. See how long you can stand on the right foot, and then work towards standing on the left one for the same duration. And the same thing with all those exercises. How many times can you swing your arm back and forth, standing on the right and then on the left? And that'll give you a sense of your progress. Lastly, I noted that your wrists lack dorsal movement towards the top of the wrist, okay? And so you can use that piece of foam and roll the wrist over that, and then just work on pushing down on the wrist in a couple of different locations. Now you've got to be careful. If you find this bump right in front of your watch, there's a distinct bump under the fifth finger. That's the styloid process of the ulnar bone. You want to go in front of it, okay? Because that's part of your forearm, and you want to capture wrist, okay? Well, you could just play with this and just work on gapping it a little bit. If you find an area that feels tight and it feels therapeutic, you could certainly lean on that for up to several minutes. You do have 2 rows of carpal bones or wrist bones, and so after you lay this right in front of that styloid process and work on the proximal row, then you can just bring it back no more than ½ an inch, and then you will capture that distal row. So that's it. I think we covered everything we spoke of, and if you have questions, please let me know, and I'll do a quick screen with you the next time that I see you. Thanks.